You're back in Healthwise, and we're still talking with Dr. Milicor regarding dengue, something that is so much with us these days. Doctora, I know that there was a recent case of an only child, and they lost him because of dengue. Was it because they did not bring him to the hospital on time?
Actually, they brought the child early, at the early stage
Early?
of the, if I'm not mistaken, second day of fever.
Oh, so that's early enough.
Yes, and the management was really, they have given everything, the doctors did well. Nothing was missed on the part of the doctor, so nobody's to be blamed of the death of the child. You see, there are cases of dengue right now wherein the doctor is just so helpless, there's nothing we can do because he would just go into shock. So it's not a guarantee that if you bring your child early to the hospital, that the child will really survive, 100%
How
survive.
scary. I mean, there's no guarantee that because I'm a parent and I'm making sure that if my child is having high fever,
Yeah.
and I make sure right away that I go seek medical
Yeah.
help,
Although
that he's going to
Yeah.
make it, you know,
Yeah,
through.
although it helps a lot when you bring the child early because you can start with your hydration. You see, dengue is a disease wherein there is no specific treatment. There is no antibiotic for it.
Medication?
None.
No
Because
medication?
yes, because it is a viral infection, and usually viral infection, they don't no need to give antibiotics because they will not respond to any antibiotics. So for dengue cases, what we just need is the hydration, the fluids that will support the cardiovascular system of your patient to prevent shock. There are some
So
cases usually.
everything that's being done is just to prevent shock.
Yes, the fluid.
Okay.
But there are some cases like the second timer or the third timer wherein the patient has sometimes will go into shock or what we call DIC, meaning will go into bleeding. So these are some cases that we need to give some blood products like the fresh frozen plasma or the cryoprecipitate or the platelet concentrate. So it's just, there's no guarantee for the doctors that, oh, we will do well with this case. So each case is different from the others. So we could not just say that all cases of dengue, if you bring it early to the hospital, they will just survive. It's
So
not a guarantee.
I guess our really main concern here
It's
is to
more on-
prevent,
I agree.
you know, being bitten.
Me too, as a mother, I really take some time and really emphasize on this on my children to really prevent mosquito bites on our children, especially during daytime. So I use this special type of anti-mosquito lotion. I no longer use the off lotion because
Okay.
I'm scared of the DEET component of it. It's a
Okay.
chemical component
chemical.
that's quite toxic also to our body. It has been noted to be toxic to the brain,
Okay.
and it's one of the possible cause of aplastic anemia. So I use this
Oh.
new lotion that we have. It's an organic type of lotion, the BioNeem. It's from the neem tree,
Neem tree,
actually.
yes, that's right.
So it's very safe to use even for babies. So this is what I recommend also.
And is it
to my
already
patients.
in most pharmaceutical, in most...
Actually, most of the pediatricians, they are having this in their clinic because we could not find this yet in the
see, yeah, because that's the
pharmacy.
first time I've heard.
Yeah.
BioNeem.
BioNeem.
Okay, okay. So you go to your doctor, you go to your pediatrician to ask for it.
Yes,
Okay.
yes, to ask
Okay,
for it. And
yeah.
second step to prevent this is really to check our surrounding for any stagnant water. So being clean, in our house. The third step is try to cover your body if you're going out.
Yeah.
Uh, Try to, especially for the children,
Yes.
maybe they can wear pajamas or long pants
Yes.
and long sleeve.
Yes.
If they are going out in those areas noted to have this kind of mosquitoes.
Or for that matter, wherever they go out, whenever they go out.
Yes.
Just to make sure. No?
Yeah.
Yeah. But then again, as what you mentioned, once you have it, you get to the hospital and get treatment. But it's the kind of it's more like a supervisory thing. You just overlook the state of the patient and then just do hydration.
Yeah,
And
hydration.
for the different types of, let's say, if it's your first time, this is the amount of water that will be given you, intravenous, whatever to be given you. And then the second time, third time, is,
Yeah,
it
actually,
depends.
when it's the first time you have it, it's so easy to manage dengue.
Okay.
Sometimes you can even manage it at home, just
Okay.
giving oral hydration. But when it's the second time or third time,
That's
that's
right.
where the game starts. It really be
Yeah.
difficult for us physicians. But although there are some